So we're going to shift to a discussion about how we can infuse the education of health professionals with evolutionary biology. And when I talk to groups of doctors, I like putting up this quote from Randy and Steve's paper. We practice and teach medicine with only half of biology. It usually gets people sitting up a little bit among medical audiences. Let's see. Looks like we're not connected here, so I'll just use the computer. On this quote, sorry? I thought I was using it, but I'm fine using the computer. That's not a problem. I tend to wander when I speak and I lecture, but I'm told I need to stand behind the podium so I can be captured. So restrain me if I start moving around too much. Jack Colwell is a family physician. There's this lovely quote that we educate tomorrow's physicians in today's system while maintaining yesterday's belief. And I think that's very apropos to our conversation today. This notion, of course, that everybody here understands, that medicine is based on biology, biology is based on evolution, but we do a very poor job in exposing our health professionals to the elegance and power of these principles. And it's a missed opportunity to introduce them to evolution as what I would think of as a foundational science. Where would it fit into our educational continuum? It's really a fundamental underpinning of all the basic medical sciences. And it's this opportunity, as people have said over this week, to integrate basic and clinical sciences in a framework or a rubric that we'll talk about. Because the image that always comes to mind to me when I think about my basic science education in medical school is of it being an archipelago, this sea filled with islands, that I think we're doing a lot better job now in medical schools of organizing into systems and disorders and problems, but still is taught at most schools in a traditional way, in a very discipline-based fashion. Randy said evolution as a basic science doesn't add extra facts, it provides a framework for those facts to be organized and to make medical education more coherent, giving students a feel for the organism. And Peter Gluckman from New Zealand says in his book, evolutionary science can be viewed as the fundamental organizing principle. All right, enough said. I think everybody's in line with this. Josh and Randy published this study about 10 years ago now that we're seeking to follow up on, as I'll mention a bit later, where they surveyed medical school deans around the United States. Was it Canada as well, or just the US? North America. Okay. And learned many things, but in brief, that very few had full-time scientists, PhD faculty with evolutionary biology backgrounds. And while almost a third said that they addressed core topics in evolution, when you really pin them down and how much exposure the students get, it's very little. It's only about 4 hours in a 4-year curriculum. So what I'm going to do is say a bit about some basic premises and the argument. I'm going to tell you, following on Carlo's approach, I'm going to tell you just a little bit about my own story and how I got into this. Described some current activities and potential leverage points that we have now, at least through my lens, and then get you to engage with some exercises together in how we can begin infusing evolutionary principles into education. And then we'll talk about work to be done. So I'd say that the aim here is to teach for understanding, not for acceptance or belief, that we should teach from evidence so that our learners can infer the principles, that we teach as much as possible via inquiry so that the learners own the material and it's more sticky that way, and we must begin with the end in mind. And I'll just unpack each of these briefly. So teach for understanding, not for acceptance. This is a digression, as it was a digression in my career. I spent a year in Washington, 2009, 2010, in the Ways and Means Committee. as a Robert Wood Johnson Foundation Health Policy Fellow, and I got to be there on the floor the day that we passed the Affordable Care Act. It was exciting being on the winning team, and it was indeed a miracle, but that's a whole other talk. But the point of showing that is that I'm a New Yorker, and I've always thought of myself as sort of a cosmopolitan man of the world, and a sort of very exposed to a diverse range of viewpoints and beliefs. But let me tell you, from Washington's perspective, from a national perspective, I'm very parochial. I didn't realize how much of a New York-centric view of the world that I had, because it's a very big country. How many of you have been to the Newseum on Pennsylvania Avenue? You ever heard of it? One? Just one or two people? Two? It's a fabulous museum. It's a museum of journalism, a museum about the news, and it's just a few blocks from the Capitol. And every morning, along Pennsylvania Avenue, you can see in these, a bad picture of these windows here, they post the front page of a major newspaper from all 50 states and 15 or 20 different countries. And you walk by there, I walk by there almost every day. And on a big news day, it was remarkable just to see what was above the fold, you know, what images they showed, what font they used, what color they used, the other stories that accompanied it. There's just tremendous variability from state to state. So my take home when I talk about health policy is that policy must be adapted and implemented one state, one hospital, one practice at a time. I think it should be obvious that evolution education, I think, also needs to be adapted and implemented at each school, each class, and perhaps even each learner. I've gone to a number of national conferences that is oriented more towards K through 12 education, and that's not something we're spending a lot of time talking about here. But when you talk about the full public and high school biology teachers who teach every student that comes through school in this country, you start hearing some interesting things. They tell us which pages of the book to glue together at the beginning of the year, the biology teacher said. The parents ask us, what days are you teaching evolution so I know when my kid will be sick? And some students are just frightened of what's coming, and they brace themselves. So I understand that the learners that we're mostly talking about have passed through several filters. And we may assume that this is not an issue for a lot of people. But I put it up here to point out the obvious, that there's a wide range of views here, and that we need to be tender about that and teach for understanding. Oh, I meant to. Yeah, please. Yeah. Please stop me anytime. And if we have a microphone in the back. Oh, I've got one here. Great.
You're talking about the students, which is a totally legitimate point. However, I grew up in a really small town, and all of my high school biology teachers that I had didn't agree with evolution either. So there's a very strange dynamic there where a lot of people coming into college even don't even have a background and never been exposed to it unless, you know, their parents or whatever taught them. So I don't know, I'd just like a comment on the teacher-student thing.
Yeah, I think I've been surprised sometimes in my own medical school of students that express strong religious views that I think for the most part, by the time they've gotten to me in medical school, they've wrapped their mind around it in some way. They've come to terms with it in some way, and it tends not to be an issue. They're science-oriented, and they're in medical school. But there's a non-trivial background prevalence of that issue, that's for sure. So when I say teach from evidence via inquiry, these are some sort of principles of using inquiry in our teaching, and I'm sure most of us are already doing these things, but just to pin it down, that we want to engage students with scientifically oriented questions, right? We're within the constraints of science. We're talking about the natural world here. We want to give priority to evidence and have our learners formulate explanations from that evidence. We want them to evaluate these explanations and think carefully about alternative explanations that relate to our scientific understanding of the world, and then be able to communicate and justify their approach to this. And this was derived, these are written in this National Science Education Standards from the National Academies Press. And when I say begin with the end in mind, as educators in the room will attest, this is a critical step to really know where you're going so you can reverse engineer the process and shape the educational program to ensure your success. So this was Randy's question. I'm so glad that you posed this challenge. How will health professional students who are taught evolutionary perspectives on health and disease differ from their untaught peers? And perhaps more specifically with regards to their thinking, their practice, their teaching and research, how will they be different? It's such an important question, and we're, I think, still closer to the beginning than to the end of being able to articulate these. And the key is that the answers to these questions, and you can't use these for your prize, you certainly can, but that they need to be measurable. The more measurable, observable, behavioral, the better they'll be from a research perspective. We want them, for instance, to demonstrate critical thinking when faced with a challenging patient. And we want them to include evolutionary rationale in their critical thinking, because we think that evolutionary thinking can enhance their ability to analyze a diagnostically challenging case. We want them to incorporate population, think about the consequences at a population level when they're making individual decisions. We talked some about this the other day. They should be able to explain a disease process to a patient within an evolutionary context using principles of evolution. When they teach, they should be integrating evolutionary principles. And from the research perspective, they should be able to distinguish and list out what approximate an evolutionary hypothesis might be for a research problem. And I'm absolutely thrilled with the work of the task group that I'm facilitating on medical education. I'm not going to steal their thunder. They're doing great work, and you'll appreciate their presentation on Friday. And actually, I was able to cut a number of slides out of my talk because they're going to do a great job with it. But I just want to show one that we probably have in parallel. Here, this notion of a hierarchy of assessment strategies. We often think about these cognitive strategies sort of at the base of the pyramid. This is based on work by Miller, where at the base we're talking about whether they know or know how. And those are usually tested in our standard ways, by knowledge tests, multiple choice tests. But the behavioral aspects of it are just as important to really think carefully about. And that is, can they show how and can they actually do? And the showing how, we're increasingly assessing through simulations and standardized patients. And it's remarkable when you watch 160 medical students respond to a standard stimulus of a patient problem. And it's just a tremendous variability in approaches, many of which are just fine, but some of which are surprisingly off. And then, of course, there's the does, which is the tip, the tip of not tip of the iceberg, but tip of the pyramid here, which is the hardest to get at in the real world, in practice. What are people doing? And there's some interesting evaluation technologies of unannounced standardized patients, where you train actors to enroll and visit a practitioner as a fake patient, and they're there to evaluate the practice. You learn some surprising things. Okay, so. You do it with their consent. It's, I think, more often used in physicians in training and residency programs. You're right, it's challenging, but very, very useful. So the argument that I make when talking to doctor groups about incorporating evolution goes something like this, that I tell them that I think there's another picture here, that when I talk to students, their eyes light up when I let them ponder the bigger why questions, these sort of evolutionary paradoxes and puzzlers of why do we sleep? Why do we age? Why is there a menopause? Why do we still have an appendix? And they are frustrated that they don't have opportunities to learn more about this sort of approach. I show them some slides that I won't hear because we've seen them all already about distinguishing proximate and evolutionary explanations. Talk about, these are just examples that I'm a bit more facile with, that I can demonstrate to them the value of an evolutionary approach to inflammatory bowel disease and its relationship to potential relationship to helminths in the microbiome. We go through the notion of cancer as an evolutionary process, talk about senescence, and talk about defense as distinct from disease. And when all else fails, you show a Doonesbury cartoon. This guy has multi-drug resistance TB and says, "How's my prognosis, doc?" And he says, "It depends." So here's a transition slide. So let me tell you just a little bit about how I get into this. Because I still, in some ways, feel like a visitor from outer space with a group of biologists. I can't quite believe that I'm here, biologists and physicians doing this. So I went to college and studied biology and loved it. Never took a course in evolution, but had a wonderful course in comparative vertebrate zoology. And just loved the whole notion of phylogenetic thinking and tree thinking. And then went to medical school and had most of that science wiped out of my brain. And I had to drink from the fire hose like all health professional students need to do. Went on, built my career as a physician and as a physician scientist. And for the last 20 years, for the most part, my work has been related to doing medical education research, health services research, that means studying how systems of practice interfere with and can be improved to enhance outcomes in patients. Doing a lot of teaching and building training programs. And then I had a kid. And my kid was approaching bar mitzvah age. And I had very little religious education growing up, actually, and decided that I was going to do more of a deep dive and started studying with my rabbi and going to services. And it was a difficult process for me because I was always struggled myself with my own notion of theology and God and my understanding of that in the world. And so I did and this is that's him just about a year ago. He also developed Crohn's disease, and that got me interested in evolution as well. But I did what most academics do when I'm puzzled. I went to the bookstore, went to the library, and I started reading. And these were some of the early books that I started diving into. And it opened up a whole world for me, as many people have said here, of reminding myself of my biological roots back in college. And I went back and started reading original papers and books about evolution per se, and eventually found these two books, that is, by Nessie and Williams and by Stephen Stearns and Jacob Coella. I wrote to Randy. I sent him an email saying, "Internist here, I have a question." And he said, "Where are you? I'm going to be in New York in 2 weeks. We're having dinner together." And next thing I knew, I was invited to present on a panel at the IOM, and I've been swept along with the energy and fascination of this since then. So let me say a bit about current efforts. And here, a caveat, this is through my lens. I know I'm leaving many things out. These are the things that I'm aware of, some of which I'm involved in. And I wanted to just kind of give you a brief survey of what some activities locally and nationally are going on to attempt to infuse evolution into medical education. So this was the colloquium that I mentioned, the Saccular Colloquia at the NAS and IOM. It led to this publication, which you've gotten a copy of, making evolutionary biology a basic science for medicine. At my own institution, we have a blog called Clinical Correlations. It's an award-winning blog for house staff. And I contributed a couple of pieces here and began kind of getting on the map at my own institution as somebody who can talk about the role of evolution in medicine. Why do we age, and sort of more general book. We've got a paper in the works for this on the adaptive functioning of fever. Within my professional society, I established an interest group. The Society of General Internal Medicine is about 3,000 academic general internists. These are usually the teachers and researchers and some practitioners in general internal medicine, but it's mainly the academic sorts. We've been meeting each year for the last 3 years to think about how we can build, mostly from an educational perspective, how can we incorporate evolution into what we do in our teaching. We have a proposal to do a special symposium next year that I hope we'll be able to pull off, if it's accepted. So, like most medical schools, ours at NYU underwent a curriculum transformation. It's still undergoing. It began about 2-3 years ago. C21, Curriculum for the 21st Century, is what it's called. And I saw it as an opportunity to offer at least an elective in evolutionary medicine, which doesn't exist at the school. And I worked with the chair of my department, a fellow named Marty Blazer, who many of you know does a lot of H. pylori work. He's an infectious disease physician, scientist. And I worked with the chair of the biology department. We put together a syllabus where we were going to talk about some of these proposed topics here, no big surprises. We were going to use model diseases with cases throughout, from malaria and metabolic syndrome and H. pylori and the microbiome. We were pretty excited about it. And we went to the curriculum committee, and they said, this looks really cool. I think you should do this. Go talk to the dean. And I went to talk to the dean, and I got a surprising response. He said, I'm a little agnostic about the whole evolution idea. He said, it's a theory. I think we're doing pretty well with proximate biology, and I'm not sure we're ready for that yet. So I hit the pause button. And what do you do when you are stymied in your own institution? You go national, right? And the plan is, in the near future, to circle back to my leadership, explaining how Yale, Harvard, Case, and UCSF and UCLA are jumping into this, and doesn't NYU want to join that fold? So I'll let you know how that goes. There was a planning meeting at the IOM led by Jay Lebov with several people in the room here and others, including a very broad group of stakeholders from the AAMC, which is sort of the Dean's Club, if you will, for medical schools. It's the American Association of Medical Colleges. A group of biologists, people from the Howard Hughes Institute, and then the College Board. And it was a broad-ranging discussion about training across the curriculum, across the continuum from kindergarten through physician training. A year later or so, Jay organized this convocation in Washington called Thinking Evolutionarily, which led to a production of a monograph at the website that you see there. And this is hopefully an ongoing initiative